Hey everybody, welcome back to the weekly Roundup, where I discuss the two most commonly asked questions or topics throughout my week visits into your offices. And this week we're going to be talking about water testing and water treatment, as well as reports. So raise your hand if you're already testing your water on a monthly basis. And nope, no hands. So what is recommended? Well, most people will recommend, as well as the CDC will typically recommend, a quarterly water testing. If you told me you're doing it every 6 months, I wouldn't be mad at you. But what you're wanting to do really is, the purpose in testing your water lines is to check any levels of bacteria, make sure they're under control, and that they're within the structured guidelines. Now, the next question is, how do we test the water lines? The quickest and easiest way is to order these little water test kits. You do them in your office. You put the water in here, you let it sit for 48 hours, and you come back and you check it. Pretty easy to read. If there's spots on the paddle, then it means we've got some bacteria. And then what we do is, there's a measuring chart that we can use to look at and see, are they outside those guidelines or within a range that's a little bit concerning. And then we go into a protocol where we'd shock the lines, and then we'd simply retest. So pretty easy to do. As far as treating the lines after you've shocked them, you're most likely already doing this. You're either using the tablets, either ICX tablets, Citrasil tablets, Patterson brand tablets, Blue Tabs, something like that, or you're using these tubes or straws that go into the water bottles if you have the self-contained water bottles. So easy to do. They last a year. You set it and forget it. They also have a built-in shock into them, so that way you don't have to worry about doing that as well. So if you need more information, obviously just reach out to me. Happy to provide that for you. So last week we talked about some numbers and some data that we like to look at. Well, one of my favorite reports, and obviously I'm biased, but one of my favorite reports in EagleSoft especially, is the practice analysis report. And what that does, that gives us an overview of our practice, how healthy it is, our demographics, the age of our patients, where they're coming from. But most of all, it's going to tell us how often are they coming in, and how many truly active patients versus inactive patients do we have. Then that helps me get the data that I need to generate other ideas or marketing ideas, reports, things like that. So if you need help, I can help you with. So today was short and sweet. Hope you got something out of it. Look forward to seeing you next week. And like always, feel free to reach out. Now, next week, I will be going to the GDA meeting down in Florida. So I'll have my phone, I'll have my laptop. Feel free to reach out if there's anything I can help you with whatsoever. If you're going down to Amelia Island, look me up. Look forward to seeing you.